Hey there, I'm Dr. Vlad. I'm a general pediatrician specializing in autism for children. And today, I want to talk about something really exciting that could potentially help us understand our little one's development much earlier. You know how, as parents, we're always looking out for our children, observing every milestone in their development? Well, some scientists have been working really hard, and there is some new research that offers a promising way to assess the risk of autism spectrum disorder in babies, and it involves something as simple as a tiny sample of their hair. So this isn't about genetics or behavioral observations later on. This is about looking at something called elemental metabolism. That's how the body processes different elements. And it turns out there may be clues in a baby's hair right from the very beginning. So researchers conducted a study where they analyzed 15 different elements in tiny hair samples taken from babies as young as 1 month old. Now, how does hair tell us anything? Well, hair grows incrementally, about 1 centimeter per month. And as it grows, it captures a timeline of how these elements are being taken up and processed by the body. Scientists use a special technique called laser ablation inductively coupled plasma mass spectrometry to get a detailed, almost hourly profile of these elements along the hair strand. Now, here's a really interesting part. By using computer learning on these elemental profiles, the researchers were able to predict with a significant level of accuracy, about 81%, which children would later be diagnosed with autism at the age of 4. This was done in a blinded analysis, meaning that the researchers didn't know which babies would get autism when they were analyzing their hair samples because they were very young. Let's just think about that for a moment. The current ASD diagnosis often relies on observing behaviors, which usually doesn't happen until a few years later. And on average, children get diagnosed at the age of 4. But this research suggests there might be detectable differences in how these elements are processed in children who will develop autism much earlier, potentially as early as 1 month old. Now, it's important to understand that this is not a definitive yes or no diagnosis at this stage. Instead, it's a way to assess the risk. The researchers themselves say this biomarker should be seen as a diagnostic aid that can help with early detection alongside a thorough clinical evaluation. But the potential here is huge. If we can identify children at a higher risk very early in life, it opens the door for earlier support and therapies. And we know that early intervention can make a real difference in a child's development. The researchers even point out that neural pathways crucial for language and social skills develop rapidly in the first year, making early intervention so important. This is a new and developing area of research. The study involved different groups of children from Japan, Sweden, and the US, which suggests the findings might be broadly applicable. However, more research is still needed to confirm these findings in even larger and more diverse populations. So while we're not at the point of routine hair testing for ASD risk just yet, this research offers a promising new direction. It highlights that there may be biological markers we can detect very early on, giving us a chance to provide support when it could be most impactful. As parents, staying informed about this kind of progress gives us hope for a future where we can better understand and support all our children from the earliest stages. For parents in New York State, navigate autism with confidence. Call our office and empower your child's development with proven strategies and compassionate care. So imagine a world where we're able to detect autism earlier, where we may be able to get kids support and intervention earlier. This is a world where the outcomes are so much more positive for kids because they will get the support they need early on so that things do not spiral out of control later on. Thank you and goodbye.